If you are reading endocrine glands or anatomy, then somewhere you will going to encounter the parathyroid gland. This is an interesting case where the metabolic doctors found some metabolic disorder, and what happened is that a 23-year-old woman, only 23-year-old, and she came in the hospital with a broken femur, the strongest bone. Okay, so they try to understand what happened by doing a lot of battery of tests to understand metabolic disorder, and what they found is that the calcium level was very low in the blood. And as we all know that the strength of the bone is dependent upon calcium. And then they try to see the problem, parathyroid gland, which is controlling the calcium and bone strength. Okay, so they done some testing and all that, but they didn't found anything special there in the gland. And then what they did is that they having some suspect something wrong was there. Okay, because that bone is very strong bone. And then they found by doing this CT, you see the underwent sonography and CT scan, but didn't find anything abnormal. And then they did is nuclear scan revealed. Nuclear scan. What? Ectopic parathyroid adenoma. Ectopic means actually it was not there, parathyroid region. Outside it is. And this is very rare, this tumor. So 1 to 2%. Okay, and that's the problem. And therefore the calcium level was depleted in the in the bone, and therefore brittle, the bone became very brittle and fracture happened. So this is interesting case. This case explain role of the parathyroid gland, parathyroid hormones, calcium regulation. If there is any kind of abnormalities like here happen, then what major serious problems can arises. And some interesting thing also, like this happens in 1 to 2% cases, and a special way it was detected, which is called this nuclear scan. Okay, so this is called here nuclear scan.